Hi, Dr. Robert Strang again, Chief Medical Officer of Health. So today we're announcing 10 new cases of COVID-19, which brings us to a total of 51 cases in Nova Scotia. Like all the earlier cases, these new cases are travel-related or connected to earlier announced cases. They are not the result of community spread. Individuals affected are in their age range from under 10 to the mid-70s, and they are in communities across the province. As we continue to do with all new cases, public health follows them up closely, identifies any close contacts, and those close contacts who are then put in an self-isolation for 14 days. So if they do become sick and contagious with COVID-19, they're away from the rest of the public. We've also tested 2,474 Nova Scotians who have had negative test results. All this, I think, indicates that our testing program works. We have focused on people who have traveled, getting them self-isolated, and getting them in through the 811 system to be testing if they become symptomatic. And almost all of our cases have had a very small number of close contacts, and they are adhering to the self-isolation. So that means when they become infectious, they're already taking the steps so they're not spreading it out in their communities. And I thank individuals for that. However, we will see it as the case numbers does increase, and we will fully expect that. We are at some point going to see a spread in our communities. We are aware of that, and so we're building our lab capacity. We have the ability to double lab capacity if necessary. Right now, we're still with it. We can do up to 200 tests a day, and we're not doing more than that. But we can overnight. We can double that into 400 if necessary. And we are starting to look for indications of community spread. So for a while now, we've been anybody going into hospital where clinically appropriate, they might have a COVID-19 illness. They are being tested, and we're now starting to, along with all the close contacts of cases, along with putting them in self-isolation, we're moving to test them now, and we'll be going back to the contacts even with our first case. And that's an indication that'll help us understand about community spread. We are actively looking at further ways that we can get out into and spreading testing into the community, people not just based on travel. And so we're aware of the issue of community spread, and we're actively building our testing and our surveillance to deal with that. The other thing we just want to talk about quickly today, as part of our health system, as part of the revised Health Protection Act order, that all regulated health professions, with the exception of doctors, nurses, nurse practitioners, pharmacists, and paramedics, all other regulated health professions now can only stay open for face-to-face care for emergent or urgent cases, but they certainly have the capacity to provide virtual care. For non-regulated health professions, like naturopaths, for instance, they all have to close. The one exception is podiatrists, who can, again, provide face-to-face care for urgent, emergent cases or for virtual care.